Hey, I'm Sarah Smith, family doctor, clinical day advisor, and the chatting coach. Welcome back to Sustainable Clinical Medicine podcast, where we're going to be interviewing peers or world experts who can help us think about our clinical day in a way that is more sustainable and create time for our lives outside of medicine. Hi, everybody, and welcome back to another episode. Today we have with us Mary Remón. Welcome.
Thank you so much for having me on the show.
Yeah, you're most welcome. Tell us a bit about you and your background.
That would be my pleasure. I am a licensed counselor, and unexpectedly, I've spent the past 20 years in healthcare supporting physicians, residents, fellows, frontline staff, and teams. You may have heard of employee assistance programs, sometimes called EAPs. They're like counseling programs for employees. And I managed the employee assistance programs on site at 2 academic medical centers. So I did that for about 15 years and learned a lot
Yep,
about the different challenges in the hospital setting. And then for the past almost 10 years, I've been exclusively coaching physicians and healthcare leaders. So I learn a lot from the challenges they face and their very unique ways of solving them.
very good. Okay. I'm interested in the employee assistance programs
Yeah.
because I've understood that very few physicians and perhaps clinicians will engage with them if they've got any concerns about, for instance, privacy or stigma associated with that. What was your experience though? Because this was on site, which was probably a bit different from how a lot of
Yes.
organizations.
Yes. Thank you for asking. Both EAPs that I worked at were completely confidential unless the employee signed a release. There were occasional mandated referrals it's which is not typical, but let's say um, a nurse is impaired and is diverting medication or something, then that's a different story where the employer already knows about it and they're requiring them to get help. So in that case, there is a certain level of reporting, but it's almost always just, did they follow through? Are they following through on recommendations? And things like threat assessments, those types of things, yes, there'd be a certain level of reporting for safety, but the majority, 95% of the work that's done, if a physician reaches out to an employee assistance program, with the exception of those cases that I described, if they're voluntarily seeking treatment, it doesn't become part of personnel files or medical records. It's HIPAA compliant, meaning it's has the same type of protection as any sort of mental health services. And people get nervous because they think, oh, you're going to talk to my employer. And that's a real understandable concern. I hate for that to help prevent people from getting help because it's such a useful, important resource. And the EAPs, we're there to protect the employees. We're there to help them. I don't know if you have questions about how to change that stigma or something more specific.
No, I think that was really just outlining from your perspective what it meant. And if a physician or clinician is working in an organization, can they find that out ahead of time? Can they ask their assistants
Yeah,
provisions if they are going to be kept confidential or if it will be spoken to the employer?
sure. They could call and say, I'm anonymous and I have some questions about your policies and procedures.
Yeah.
You could just call the Employee Assistance Program directly.
Yep. Yep.
Yeah,
Okay, good. I think that's going to help because I think a lot of physicians aren't necessarily using the people who've been put in place to help them if they have these concerns on the back end of what's going to happen to the information I provide here.
of course. Yeah. So just call. There are policies and procedures in place, and I'm sure the EAP could provide them, but EAPs are known to be confidential. And probably what the physicians are worried about is they hear about these rare exceptions where someone is an immediate danger or something, if someone's in immediate danger, any mental health professional has to speak to protect life. But those are rare, rare exceptions. And so I really want to encourage physicians to make use of these services that are there for them. They don't have to. They
Mhm.
can seek outside help. They can speak with a peer support group, or they can seek coaching. One reason that I'm a licensed counselor, but I offer coaching for physicians is because there's no diagnosis, there's no
Mhm,
paper trail. And so
mhm,
it's just removing the barrier that anything that they have to worry so that because these archaic licensure policies, which are changing in 40 out of 50 of the states so far, I think they're changing so the physicians don't have to report speaking to a counselor, they just have to report impairment, which is totally different. And that's how it should be. So it's
yeah.
changing, but still the trust isn't there for a reason because in the past they had to report getting help, which of course we know causes a stigma, which is a barrier. And then we have such a high rate of
Mhm.
everything, right? The burnout and unfortunately a higher suicide rate. And so it's one of my life's mission to just be able to reach these people who are such important members of society and who are suffering in silence.
Yeah, yeah. Okay, so then tell us about your understandings or what you've seen over this course of your career in regards to physicians and clinicians and their sustainability within their careers. What are some of the topics coming up that you're noticing?
Yeah, I'm noticing that, and I'm learning more and more lately that we have a physician shortage, that people are dropping out of the profession. And I'm glad the conversations are happening more than ever, but they're dropping out not because of a personal failure. And I think they what I hear them saying is that they blame themselves a lot of times. They think that they should be made of steel. I actually had a recent LinkedIn post saying we need to flip the narrative about that because doctors are taught they need to be made of steel. And really it's, when was the last time you asked a doctor how they were doing? Or for that matter, when a doctor shared how they were doing. So the idea of speaking up is super important. And yeah,
Mhm.
that's one thing that really, really needs to change. But people are doing other things, which is fine because burnout is not a failure on the part of the physician. It's they're having a normal reaction to an abnormal situation, right? And so if they need to become an entrepreneur or do what they need to do, great. But the bottom line is we need to make medicine more sustainable.
Yeah.
Yeah.
Tell us about some of the burdens that the physicians or clinicians are experiencing in their workplace that would drive them to come and look for a counselor or a coach that you're noticing coming to you.
Yeah, absolutely. There are a lot of burdens. Do you want me to talk about the reasons for the burdens or the symptoms?
Or, or even the symptoms that they're describing to you.
Okay, okay. Interesting question. I find, and this is not an illness, okay, but imposter syndrome. It might just be imposter thoughts. This
Hmm.
is not pathological at all. Most of us have them. What's kind of interesting that I've noticed is that the physicians who should be questioning themselves aren't, you know, they're not asking for help. They're not saying, oh, I'm in over my head here. Maybe they're overconfident. And I've said that to residents when I give orientations. The ones who ask for help, I'm not concerned about. Yeah, I mean, it's the ones who don't, so they're writing down everything I'm saying. Oh, okay, ask for help, make sure that I speak up, ask questions when I'm in over my head. But imposter syndrome is so ironic because it's some of the best and the brightest physicians and people who they don't think their best they're doing their best, but it's not perfect. And none of us are perfect, right? So it's this unattainable thing that I'm seeing. So it's that. I also see, for example, I was working with a hospitalist who he spent all day, every day helping people. And then he would go home thinking about the one thing that he should have, would have, could have done differently. And
Hmm.
looking, kind of beating himself up, looking at what went wrong and what could go wrong. And that mindset carried over into his personal life. And it kind of became like his outlook, and he wanted help with his mindset.
Yeah, we see that a lot, that rumination of I could have, I should have,
Yes.
and we often forget. But you were given 10 minutes for that one little piece. And in an ideal world with half a day with that patient, you might have done something differently, but you had this small segment of time, that reality checking about it, or the removing the I always do my best and this outcome happened separation.
That's a very good point that you made. Like those things can coexist. You can do your very best, and there are things that we can't predict that are beyond our control, right?
Yeah. No, I think the training in medicine where we are our worth is tied to our performance creates a terrible cycle when it comes to that self-reflection and rumination about what I could have, should have done
Yeah,
differently.
yeah.
Imposter syndrome, perfectionism, and what is the cost? What are you seeing the physicians saying about this rumination? Like that costs you, like I can imagine that stops you sleeping well, for instance, or being able to relax and rest well.
It does. I mean, sleep disturbance, it already physicians are sleep deprived, so we don't want to have them having sleep disturbance. It can cost them in their personal relationships outside of work, and also maybe irritability at work and
Mhm.
interpersonal conflict, which usually I think most people need rest, and they don't necessarily need training and communication skills. Some people might benefit from it, right? But when I'm well rested, I'm probably more pleasant, and I think that's generally how people are, even babies, right? So they need rest. But yes, some people actually become clinically depressed, which is different from burnout.
Mhm.
Mhm.
How would we notice clinical depression versus burnout? What are the types of maybe risk factors or things we're noticing about ourselves that might have kind of created more than just burnout in us?
Yeah. It's a great question because there's a lot of overlap.
Mm.
Burnout is interesting, and I'm learning from people that it's the kind of tired that sleep doesn't help with. It's like lacking the spark of what matters most, what gives life meaning. So it's this disconnection from purpose. And the symptoms of that can overlap with depression and can even turn into depression. So clinical depression can happen to anyone, even if the sun is shining and they have an easy job and they're a meaningful job. So it's the origin is possibly different. Life events can lead to depression, but depression can also come out of nowhere. Yeah. And so, but either way, there's a risk involved, right? Because burnout and moral injury, if they're unaddressed, they're kind of silent and sneaky. And it's like you don't just notice one day that you're burnt out. This is what I hear. It sneaks up on you. And that's kind of the tricky part. And I was actually working with one physician who actually asked his wife to hide the guns in the home. He told me he suffered from burnout. He didn't want anything bad to happen, but that really concerned me that for him to say that to me and his wife, things were scary bad, right? So at that point, it's definitely has crossed over into depression. Yeah, so that can be serious. I don't know if I answered your question clearly enough.
I think we're just kind of and we're not obviously in the realm of diagnosis. It's just
Yeah.
more the noticing of really what does it look like to have these high levels of burnout? What does it look like to just have that suspicion that you may have perhaps even depression with it? Things that physicians might notice about themselves in the story to say, oh, I should probably reach out for
Yeah,
some assistance
yeah,
because I'm
yeah,
noticing that even when I've slept really well, I
yeah,
get to open my inbox, I look at the number, and I suddenly feel completely drained again, and I
yeah,
don't want to do any of it. Um,
yes,
and
yes,
part of both. You're right. It can be part of depression. It can be part of burnout, but it's just the noticing. If I notice that I feel like, okay, I slept okay, I'm dreading work a little bit, I get to work, I open my inbox, and the whole thing becomes a big disaster. Okay,
You
that's not
said
good.
that really well. That's definitely can be burnout, right? Just feeling so overwhelmed, not knowing where to start. It's different from the Sunday scaries, or everybody has a little bit of I don't want to go to work. It's more like dreading work. And there's also compassion fatigue can be combined with that, which is very real, and it comes from a prolonged period of caring. It comes from caring and sometimes too little self-care. And then people become numb. So numbness to a patient's suffering or to one's own feelings, right? That feeling of numbness, disconnection, not finding joy or meaning in work or life outside of work. Just pure exhaustion is what I hear from people. Is that what you also hear?
Yeah, definitely. So that the frustration of what they don't appreciate me. Why do they keep asking me all these questions? I don't want to find the answer. I don't want to help. I don't want to figure it out for them anymore. Why can't they find someone else to help them figure that
Yeah.
out? Yeah.
Yes, yeah. They don't want to do it anymore. They're like, I have nothing left to give.
Yeah, I have nothing left to give. The tank's empty. Don't ask me for the answer today.
Yes. You
Yeah.
nailed it. That's
All
really
right.
cool.
So if we've got high levels of burnout, or if we're starting to see some of the early signs of burnout, what do you as a coach offer? So how does approaching somebody to help us in this, because we've still got patients, we've still got inboxes, we've still got our work schedule, our on-call schedule. What
Yeah.
happens within the space of coaching that can help us make this sustainable?
Yeah, that's a great question. It's really baby steps. It's not a quick fix. There's nothing, I don't have any promises like that, but I do see people recover. And sometimes people tell me one of the most helpful things I ever said was just the fact that there's a light at the end of this, that they will get better because they can't see it when they're feeling that way. But being able to name it kind of takes the power away, the power of the burnout. Being able to name it and talk about it is huge. And so many physicians are in silence. So once they're talking about it, you can kind of see this. They're not better, but they're like a little bit lighter because they're not keeping it all inside. And then it's really about small shifts. I see them making small shifts. Like a physician I worked with, she loved gardening and she completely let her garden go. And meaning it was just rocks, it was just rocks and dead weeds and stuff. And so like this is a small thing, but it was a promise to herself. She planted one flower, okay? One flower. And I asked her questions like, what's one thing? Because you don't want to give people 20 things. What's
Yeah.
one thing that you could do that would help you reconnect with your purpose? She actually did two things in a week, two things. One was she spent a little bit longer and intentionally listened to a patient. And the other thing she did is she went back to mentoring a resident. And those were maybe they seemed like small actions, but those help propel her. There's a law in physics that an object in motion stays in motion. So the idea is baby steps. Start taking them, even though you don't feel like it. But then once you plant that flower, once you listen to that patient, once you meet with the resident, you're going to want to keep going little by little, and you're going to want to plant another flower and maybe schedule time for things that are meaningful to you, to make time for those things. And it might only be a 5-minute walk. People don't have time. That's big part of the problem. But it's always something is better than nothing, right? So if it's a 5-minute walk, that's better than 0 minutes, right? Fresh air, sunshine. So that's a small example.
Yeah, I think that's an important shift because I think a lot of us think if I can't go for that prescribed half an hour or 60-minute
Yeah.
walk or exercise routine, what's the point? There's no point. 5 minutes isn't going to do anything to my cardiovascular system. Like it's this all or nothing effort that is, to think about a 60-minute walk might today be too much effort. I like what you said about the sharing of the experience, because I know that within our trauma
I think you're frozen. Can't hear you or see you.
Hmm,
I lost
there
you.
we
I'm
go.
sorry.
I know
Okay.
it's okay. My internet freezes at
Oh,
times.
okay. Tell me again.
So I think that the 5-minute walk versus the 60-minute walk, when we're in that state of, well, I don't have 60 minutes today. I've got these other compelling obligations in front of me. But knowing that the 5 minutes is a step towards, it's a choice I'm making for me today, and I'm allowing me to start and not get it perfect and not doing it in the perfect way.
Right. If we set the bar too high, we're more likely to not do it at all. It's human nature because it's all or nothing. It's like, I already failed at this. So now I'm going to go eat a tray of brownies and not go for a walk at all. Right. Instead of, how about we set a 5-minute goal? And if it feels good, you can walk longer. Right. So you set the bar low and it celebrates small wins. And I hate to say yoga class because it sounds overly simplistic. So I'm not saying that yoga cures everything, but I did have one client who was clinically depressed and they were seeing a psychiatrist. The medication wasn't helping enough. They had burnout, but also they went through 2 serious losses in a short time in a row. So it was a heavy depression. Medication and counseling alone wasn't enough. And even the idea of the 5-minute walk wasn't enough. And back to the object of motion stays in motion. This person made a leap. This person made a leap by joining a yoga class that met once a week for an hour. But that was for them like a deal breaker. That they started feeling better by the second session. I'm not saying they were cured, but they felt the absence of depression. They felt good and they continued going. And like from the time they started yoga on, I was working with a different person.
I've seen that, and I think one of the ways I've heard it expressed was I didn't feel trapped by my obligations at all times because I was going to this class and it felt like rebellion because I still have incomplete inboxes and incomplete chart notes and obligations to all the things in my life and the kids and the spouse and the work. But there's this one spot I get to be rebellious and go to this class once a week, and nobody knows who I am.
Anonymity, right? Yes, and it
But
is rebellion.
just it's a space I get to go. It's time, so I want to turn up because I have to be there at a certain time, so I have to get to do the things. So it really doesn't matter if it's yoga or anything else. It's that ability to say, I'm not trapped. I get to make a choice for me and I get to go to this thing. I can see how that starts to change your brain a little bit.
Mhm. I
Yeah.
love how you said that, the rebellion.
The
Like,
rebellion, well, it does feel like it because you feel compelled. Everything's important and of high priority. And if I don't get this done, I can't allow myself
right.
to have a life. I can't allow myself to have joy if I still have incomplete this or that. Like we see this constantly trapped brain
Yeah.
of obligation to all the things that are still yet incomplete.
Yeah, that just touches my heart the way you said that. I can't allow myself to have joy. That really resonates. I hear that a lot.
I hear that a lot too. And it's not what we want for our friends and colleagues. That is really the opposite of what we want when it comes to
Yeah,
sustainability. Who wants to stay trapped to that? No, thank you. Yeah.
exactly. Exactly. So call it rebellion. I love yeah. Yeah.
Yeah. The other thing I think I heard about that was they come to you and they tell you their story. And we know that the act of sharing the burden of what's happening on the inside is part of that trauma-informed lens of just this is what's happened to me, this is what's happening to me, this feels too much.
Mm.
I don't know how to reconcile any of this, but I don't feel good. Being able to take that out of you and dump it
Yeah.
somewhere to
Yeah.
person who's got the time and the skill
Mhm.
to listen and to help you make meaning of that and to help validate that is
Mhm.
so incredibly important when it comes to the trauma and the burnout story.
You're so right. And sometimes it's that simple. It's being able to share. Physicians hold so much in. They often don't want to tell their colleagues that they're suffering. It's this whole badge of honor, and it's not their fault. It's the system was set up like this for everybody to have this armor, right? And yeah, and of course there are a lot of things that need to be changed within the system. I'm not a systems expert, but I really hear from a lot of physicians, and I'm learning that really it's the system's not sustainable. So we need to change that. We need to change a lot.
It's a lot to be changed. I think the other thing is you might have good colleagues and friends.
Yes.
See their level of burnout. You can see how much they've changed. They're not the same as they were before. You don't have the capacity to ask them about that because you're suffering too. But the last thing you want to do is burden them with you.
Yeah. Do you think that that's a misconception that they're burdening them?
So I think if you can see that your colleague is also here running late and is also working this terrible schedule and is also trying to get home to their kids, and is
Yeah.
also struggling under the why aren't you home on time
Right.
questions from home,
Right.
you don't want to be sharing
Right.
you're not doing well with them because you know they're not doing well either. There can be a bit of that, oh, this is so hard banter, but there's no sit
Right.
down, take a time to really
Right.
share the story of you and hold that for somebody else.
Right. It's
It's
almost like
protecting them. Yeah.
protecting them. Right. Right. It's almost like you're in battle together.
Yep.
And it's like, oh yeah, I see you're wounded too. Okay, let's just keep going. Right.
We're still
Yeah.
wounded. Let's maybe a
Right.
band-aid, but we'll keep going.
Right. Here you go. Like make a tourniquet. Let's go next. Yeah. And you're right. They don't want to burden someone who's also suffering. The catch, there's a flip side to that though. It's kind of like when you do have a real conversation, when you can make time for a real conversation, it's almost liberating, you know. It's like, oh, you're feeling like that? Oh, me too. This is really hard. I'm not feeling like myself. And then other people start sharing, and it actually can become super supportive, but it's a matter of opening up to the right colleague at the right time. And I could see why it's hard from the way you described it.
hmm Sometimes it can be distant, so you may have a colleague who's not working in your bucket of awful.
Yes,
So,
yes.
but in the town over, they get to dump on you and you can dump on them about what's going on in the town. That could be a way to kind of use your colleagues, but not necessarily
Yeah.
within your, like you said, in the same
Yeah,
battlefield.
yeah, yeah. You can maybe find the one who doesn't need the tourniquet and find someone else to open up to, whether and it can even be someone outside of work. What I have found is that a lot of physicians, they don't want to have to explain their jobs to people. They don't want a therapist who doesn't know the difference between a US resident and a Canadian resident and a medical resident. They need to know what an EMR is or an RVU. They need to understand. They don't want someone saying, well, why are you working so many hours?
Yeah.
So I think that it is helpful. It doesn't have to be me. It doesn't have to be you, but I want them talking to someone. And if they can find someone who knows, it doesn't have to be a physician, but they need to understand what is a physician, right? What are the stressors? What are the common things? Someone who can say, you know what, you're not alone in that. It is so common to have compassion fatigue. It is so common to have imposter thoughts. Like, I almost want to put them all together in a room. If they had time, it could make a wonderful support group because they're not alone. You hear the same themes over and
Yeah.
over, similar themes, I should say, right?
Yeah. Yeah. That's right. Yeah.
Yeah.
All right. What are some of the tools that physicians can use or clinicians can use to help them be more sustainable in their day to
Mm.
day? What other types of strategies that you see as effective for handling the constant added
Yeah,
on things, the
yeah,
constant
yeah.
overworked?
Yes. Some of the physicians I work with struggle with saying no, and they need to learn to say no and be assertive to the things that are optional, to the things that are extra. I usually ask them, do you love to say yes or do you hate to say no? And either way, that question, they stop and think, oh, that's a good question, and they have different answers, but there's an issue there. And if they can find a way to say no in a way that sounds like a yes, like if I were to say, Sarah, thank you so much for thinking of me. I would love to work with you on that project. Unfortunately, my schedule won't allow me right now, but I really hope that you'll think of me next time, maybe check back in January, right? Something like that. It sounds like a warm yes, but it's really a no. You blame your schedule, right? And assertiveness is part of it too. So teaching assertiveness skills. A lot of people are kind of people pleasers. They're used to being A students. Everything that worked for them in school is backfiring in medicine. The people pleasing, nobody's going to set a boundary except you. Like that's the hard truth. Nobody's going to say, Sarah, you've been working too much and you need to not join that committee. And you probably should delegate and go home early, and it's like, who's going to say that? Oh, sorry, Siri's chiming into our conversation.
I love it when physicians have got that person, that spotter, that somebody in their life who says, what are you saying yes to now? Are you sure you want to do that?
Oh, please do that for each other. Please do that. Yes. That's where I mean, I will be happy, but most of them don't get to me. I'm the one who does it, who does that. But if they can do that for each other, and it might be a loved one at home, it might be a best friend, it could be anyone that kind of helps them like say, okay, why are you writing a book at the same time? And why the extra right now? So that's helpful. And we talked about scheduling well-being time. We talked about accepting support, right? Another thing that helps in coaching is remember, I talked about the hospitalist who would go home every day thinking of the one thing that went wrong. Okay. So I do work with people who want to shift their mindset. Is that something you'd like to hear about?
Yeah, let's do that.
Okay,
Absolutely.
okay. All right. So the physicians are trained, as you know, to spot what's going wrong and what might go wrong. And that's great. It keeps their patients safe. It's just that when that some people, not all, some have a hard time turning that off. And so those are the ones who are constantly looking at what's going wrong, what might go wrong in life. And even this physician had a hard time accepting compliments. It was just nose to the ground. And so you can actually strengthen your neural pathways by practicing regularly reflective questions. So this particular physician asked himself 3 questions every night. It was, what went well today? When did I feel most like myself? And what can I carry forward into tomorrow? And in doing so, gradually, he was able to start strengthening the neural pathways. What went well today? It might be, I got a thank you from a patient. When did I feel most like myself? I was in the flow in the OR. I didn't have to think about it. And everything was just going smoothly, right? What can I carry forward into tomorrow? I, I meant to do this. I want to reconnect with my purpose. That just might be example answers, but it's kind of
Yeah.
like gratitude, right? When you start scanning your environment for things that you're grateful for, the more you'll find to be grateful. And I don't want to sound like toxic positivity. There is science and research behind this. And there's also research saying that physicians who are in a positive mindset actually make faster and more accurate diagnoses than physicians in a neutral mindset. So there is value. It's interesting in retraining that mindset. And some people say, well, am I going to lose my ability to see what's going wrong? And I'm like, no, you're still going to have that superpower. Of course, you're going to be able to diagnose and treat. It's just that you're also going to be able to see what's going well. And that really helps reconnect with the purpose.
Yeah. We can see that in everyday life when we've got a patient in front of us who's got some undifferentiated symptoms, and you are at the end of a shift and super tired, or if you're really, really frustrated by something else that's been happening in your day, or you're really, really anxious for 100 different reasons why you could be feeling anxious. It just makes this encounter in front of you so much harder. It's so much harder to just, it feels like you're thinking through mud. It really makes that slow down to really try and pull this all together. It's so much harder. So you can see how if you're in that, I'm no good, this is no good, the system's failing me, this patient's frustrating me, I don't care why they've got back pain, and now I've got to actually start to engage with this patient about their back pain. It's going to be so much harder than if you're having a day where you've started to notice that nurse was really helpful to me today. I'm so glad I got lunch today. There's ways where our brain might be better in its working memory executive function if we're in that improved state, human
Definitely.
ology state. Asking great questions, we'll find evidence for what we ask for. So if we ask what went wrong today, we will find it every day. Our brain loves negative gearing, like you said.
Yes, it does. It does.
And so the asking great questions about what went well today, our brain has to kind of pause and be like, that's a strange question. Why would we ask that question?
I know, I know. I ask my clients, usually I start off, one of my questions is, have you had any wins? Any wins, big or small? Long pauses. It's so hard to think of the wins. And and I'm like, keep thinking. I'm gonna sit it out, you know. And then they'll come up with something that they think is itty bitty and is actually like huge, a huge win, you know. Like maybe they actually just dropped off of a committee that was draining them or something. It's like this, that's a big deal, you know, but they're not realizing that that's a win. So
Yeah. Yeah, just that ability to ask your brain different questions because it's really good at finding answers, but it usually has the same set of questions that are creating the experience you're having right now.
you're right, right.
Show me all the ways you're trapped in medicine right now, and you'll find 100 ways right now because you ask that question of yourself all the ways, all the
Yeah,
time.
yeah,
I'm
yeah.
never free of this. It's never done. The system doesn't like me. It's failing me. It's failing my patients. So we see that constant
Mm,
self-reflection and that same question being asked, and we're very good at finding that answer. So
yeah,
asking this new question of what's going well today? What
yeah,
are you enjoying about this day
yeah,
today? Is
yeah,
just a different, you're just asking a different question.
exactly. When did you feel most like yourself this week? Right? That's a lovely question.
It is a lovely question.
Yeah. And they might say, I didn't feel like myself. Well, still, let's talk about that, right? Yeah. But just if you do that regularly, every day for at least a month, your mindset's going to start to shift. It's not magic. It's just habit forming, right?
Yeah, yeah. Wonderful. Thank you for this conversation, Mary. Is there anything we didn't talk about that we should talk about before we end?
Mm, make use of your supports, really. I can't emphasize it enough. And we just got to keep having conversations like this. People shouldn't be suffering in silence. And so we talked about protecting your energy today. We talked about trying to shift your focus to see what's really going well. And we talked about the idea of accepting support. And I think those are the three main takeaways I want to instill in your audience. And I'd be happy to be a small part of a big solution.
Yeah, yeah. And how do people find you if they're looking to reach out?
Well, they have to spell my name right. That's the hard part. So it's my website is maryremon.com. My last name is spelled Remon. So they can find me on my website. Also, I have a pretty active presence on LinkedIn. If you could look up Mary Remon. and I give complimentary consultations, no obligation. I'm really about reducing barriers and coming from a place of compassion. And there's nothing to be ashamed of. I'm a big believer in capitalizing on people's strengths. So it's very strength-based, positive, supportive approach.
Love that. Well, thank you so much. And everybody have a great rest of your week. Bye.
Thank you.
Hey, if you found this podcast episode helpful, I would encourage you to like and subscribe. Every time you do, you help a colleague or friend find our podcast, and it can help them too. Don't forget to share it along with your friends. If you're looking for extra help, don't forget we have charting champions for physicians and smarter charting for nurse practitioners and other clinicians to help you get home with your work done. We are helping you create sustainable clinical medicine. Thanks for listening.